Welcome to the Fibromyalgia Podcast. I'm Tami Stacklehouse, fibromyalgia coach, author, and founder of the International Fibromyalgia Coaching Institute. The goal of this podcast is to empower you with access to the dream team of experts and coaches I've discovered are key to living the fibro life you love. From the comfort of your own home, and maybe even your pajamas, I'll help you take back control of your life and health. To help out with fibro fog, I always include full show notes and additional resources at fibromyalgiapodcast.com. Welcome to the Fibromyalgia Podcast. I'm your coach, Tami Stacklehouse, and this is episode 92. After our last Ask the Coach in episode 90, where I covered the 3 FDA-approved medications for fibromyalgia, several specific questions kept popping up. You asked about becoming dependent or addicted to medications. You asked about withdrawal symptoms, how to come off these medications safely and easily, and how to know when it was time to start reducing or discontinuing your medication. In today's episode, I interviewed Dr. Chelsea Liebowitz. Chelsea is a doctor of pharmacy and a pain patient herself, so she knows all about these questions and the important role your pharmacist plays as part of your healthcare team. Now, make sure you keep listening after the interview. Unfortunately, after I stopped the recording, Dr. Chelsea gave me some tips about what to do if there are specific medications you can't afford or if your insurance denies coverage. So make sure you stay tuned after the interview. I'll have that for you. Now, let me introduce you to today's guest. Dr. Chelsea Liebowitz grew up in Farmington Hills, Michigan, where she endured her fair share of chronic illness. Despite constantly feeling ill, she was determined to find answers and went to the University of Michigan in search of them. 3 degrees later, the answer wasn't found in school classrooms. It was found when she learned to trust herself. Chelsea now coaches other patients with chronic jaw pain and has a vision to upgrade the health system to provide better service to those struggling with chronic pain. She is the author of TMJ is Ruining My Life and Life with a Service Dog. We will have links to Dr. Chelsea's books on today's show notes page. Just go to fibromyalgiapodcast.com/92. Now, you know, I have to remind you, the information included in this podcast is never meant to be considered medical advice. We are here to educate you. And while Chelsea is a doctor of pharmacy, she is neither your doctor nor your pharmacist. So please take everything that you hear today to your doctor or your pharmacist and let them help you with the information you learn here. Here's my interview with Chelsea. Thank you so much for being here. I have been looking forward to this conversation ever since we talked about it. So welcome and hello.
Thank you for having me. I'm so excited to be here and happy that I can contribute to your conversations.
Absolutely. Absolutely. So I always like people to start with a little bit about their story. Because of course, as I said earlier, when just you and I were talking, you're here as a pharmacy nerd, but you're also here as a patient. So
Yes.
Tell us a little bit about your story so people know where you're coming from.
All right. So I have had chronic pain since I was about 11. I developed scoliosis that got worse when I was about 13. And, you did the standard, go to the doctor, pediatrician, touch your toes. And then suddenly he pulls out this thing and starts trying to measure it. And he sends me to x-rays and I get an x-ray and my curve is already like over 40 degrees. And so he told me I needed surgery. I went to an orthopedic surgeon. He told me I needed surgery, but he doesn't do kids. I went to a pediatric surgeon and they told me scoliosis wasn't painful, that my curve wasn't that bad. Even though it was 43, they're like, we don't do surgery until it's 45. And that was like my first experience with a serious illness in healthcare, that not every doctor is going to listen to you, that some doctors will just tell you it's not painful. And as a young kid at 13, when they're telling you it's not painful, but you're experiencing what you understand to be pain, It's very, very confusing and it's very gaslighty, right? It feels like,
Yeah.
am I making this up? So I had scoliosis, I had spinal fusion when I was 15. Also, around that time, I was having really bad issues with my jaw, with my TMJ, dysfunction. Again, doctors just didn't know what to do. I had some other things like tonsil surgery and I had sleep apnea, and I just had condition after condition, and I was always in chronic pain. So even though I had my spinal fusion and my scoliosis was basically correct, I still had back pain, I had stomach pain, I had jaw pain. And when I would ask the doctors what's going on, they didn't really have an answer. A couple different doctors said, "Hey, this sounds like fibromyalgia." And I was like, "Okay, great. What are we going to do about it?" And back then, they didn't really have any answers. They're just like, "Oh, well, it's just this fancy diagnosis." And I was like, "That's cool, but I want to get better." And so when I would go look up fibromyalgia, it's like, take Cymbalta. And I was like, okay, I was already on Cymbalta. And I struggled. And so when I was, going through high school, I was like, I want to be a pharmacist. I want to find the answer for pain. And when I got there, I got a bachelor's in neuroscience. I learned all about the brain. I got a master's in clinical research so I could do the research. And I got a doctor of pharmacy degree at the University of Michigan to become a PharmD. And ultimately, the answer that I found was that you have to trust yourself and believe in yourself, because the meds, while they can help, they're not going to cure the problem. And I went and found the root cause. And ultimately, the root cause for me was I had heavy metal poisoning that was undiagnosed for over 10 years. And so that was just contributing to a lot of my pain. I was a pain patient. I had issues with my back, and everything just hurt all of the time. Go to therapy. Okay, I've been to therapy for 7 years. It's not helping. Take this med. Okay, I've taken this med and I've maxed it out. And I tried the alternative and I maxed it out. And now I'm on 3 meds. And I don't know what to do. And it was just like really frustrating. And I feel for all of the patients who are in that system who don't have the advanced knowledge like I do from pharmacy school. I literally did not even find out I had copper toxicity until my last year of pharmacy school. I spent 9 years in college in the healthcare, like, I want to learn about healthcare. Eventually, I was like, all right, pharmacy school is not going to teach me the answer I need. I need to go find it.
Yeah. And that in your story, I mean, like the details might be a little bit different, but wow, that is so much, so many of our stories.
Yep. Just not feeling heard, not being listened to, being told to lose weight, but maybe there's a reason we're not losing weight. Maybe it's not actually weight, it's just inflammation. So for me, I had a lot of just inflammation, and I like weighed the same amount I do now, but I was just really bloated and you could see it. And going to a doctor and them being like, you should lose weight. Like, I'm like, wow, you really just don't know or don't care? Like, what am I supposed to do with that?
Yeah, I know. I know so much, so much. Well, I'm glad you found your answers. And I love what you said about finding answers within ourselves. I mean, sometimes it is like past trauma or mindset, or, like sometimes it's that psychological component, but
Hmm.
sometimes it's just trusting ourselves that this answer isn't quite right yet. Right.
Yes,
And being able to
100%.
keep looking.
It takes anyone with a chronic illness, it requires determination and grit for them to get answers. And it requires more than someone who doesn't have a chronic illness, which is ironic because we're just so sick that, like, it
We
takes
have
so,
less.
I know we have less, but it requires more, and it's hard. It is so hard.
Yeah. Well, tell us a little bit about, you mentioned a couple of things in there, the PharmD. I would love for you to talk a little bit about your training as a pharmacist, what that even really means, and then what it means to be a PharmD.
All right. So PharmD is a doctor of pharmacy. It is a professional designation. I am a doctor, which is very cool. It's very exciting. So PharmD is pharmacy school. There are some schools where you don't need a bachelor's, but you're usually going to spend at least 6 years in college. It's like pre-med, like, before they go to med school, they take pre-med courses. Same courses are required to go to pharmacy school, a little heavier on the biochemistry and medicinal chemistry kind of things. And so we went to 4 years of pharmacy school and we learned about all of the major illnesses. We learned what the test results look like. We learned what the medicines are. We learned the black box warnings and the precautions for them. So a doctor goes and they learn about the test results and they learn how to diagnose. They're the problem solvers. They see the test results, they're going to come up with an answer. The pharmacist then is going to say, okay, So for instance, if you're sick, if you have strep throat, you get a test, the doctor says, oh, look, your white blood count is high. Let's do a test for strep. You have strep. And then it has a specific bacteria. The pharmacist will know which medication will best treat that bug.
Mm-hmm.
We call it bugs and drugs. And so it's cool too, because like, for instance, there's like heart medications like lisinopril, and there's a whole bunch of different kinds. And like, you're like, which one do you take? The pharmacist will help make it the best for you. So sometimes it has different side effects. Some, like I know some antidepressants cause weight gain, and there's a couple that cause weight loss. Which one do you do? The pharmacist is going to know that versus the doctor.
Right, right. It sounds like you go to school basically just as long as the doctor does. You're just studying drugs and bugs, I guess.
Yes, yes. We just study the drugs. We learn the pharmacokinetics. So sometimes the difference between a medication is how it is released in your body. Like, for instance, you might see extended release versus sustained release versus XR. They all mean something different. It has to do with the way the pill is set up. Because if you swallow it and you just don't put any of that stuff in it, it just dissolves in the stomach and you don't actually absorb much. Sometimes it has to go through and it actually needs to be absorbed in the small intestine or the large intestine. So we learn all about that. We learn about which sometimes they add a fluorine to like a molecule, right? Like a lot of birth control pills are basically estrogen, and then they add a little molecule on the outside to basically be able to patent it, because you can't patent a bioidentical hormone. And so it's just, we learn about the medicinal chemistry of it. We learn about the pharmacokinetics of it. We learn about pharmacy in general. There's a lot of laws that you can do and can't do. And we work really closely with doctors. So the reason when I wanted to become a pharmacist, I literally went and followed a hospital pharmacist. And the coolest thing to me was that, well, this part isn't cool, is that someone coded. But what was cool to me was the pharmacist was like, hold on, I got to go. And she went on to the code. And that makes sense to me, because when a patient codes, yes, they can do the defibrillator, but they're usually giving them a lot of medication like epinephrine and all these other medications and the critical care medications. And you want a pharmacist there to make sure they're reading the chart that says, hey, you can't give them this medication because this medication interacts with this other medication they're on. So you want a pharmacist there. The pharmacist is going to know that. They're going to quickly be able to identify the drug-drug interactions. And I think it's that I was like, I want to be a pharmacist.
Yes, I can imagine that being so, like, my brain works that way a little bit too, like just the fitting all the puzzle pieces together and yeah, the science part of it and all of that. You know, my first real experience with this kind of pharmacy that you're talking about, my doctor prescribed something for me. I took it into the pharmacy and the pharmacist was like, oh, if you take this, then you're going to need to make this other change to this other medication, because it was one of those things where it made birth control less effective. He's like, so you need, do this. And I was able to go back to my doctor and say, hey. So it was really interesting to me how, it wasn't just somebody there to do whatever the doctor said.
Right. And it's very cool. And it's hard, to be honest. It's hard, especially since COVID. A lot of retail pharmacists are pretty overwhelmed, but there's pharmacists in other situations, especially if you're taking a specialty med, the specialty pharmacy is a little more available. I know for me, I work for an insurance company, and I'm available to be talking to patients if they call me and they have questions about medications. I'm there for them. And there's pharmacists in different situations. Retail pharmacy has skewed the way pharmacists can be. Retail pharmacies are wanting pharmacists to basically fill 400 prescriptions a day. But really what pharmacists should be doing is counseling the patients and talking to them and saying, hey, let me help you with this medicine. Because when you get a new medication, it is scary. And you can always go to your pharmacist and say, hey, how do I take this? What do I do? And they'll sit down and talk to you about it. They'll talk to you about the side effects. They'll ask you how your doctor told you to take it and give you some extra hints, like, should you take it with food or not? And all of those things. That's what it's in a pharmacist's wheelhouse.
And I think that can be really, really valuable for those of us with brain fog, we're dealing with chronic issues. Those of us who tend to be a little bit sensitive and have more maybe side effects than other people, like the pharmacist is more your go-to person for that than actually your doctor, wouldn't you say?
Agreed, 100%. 100%. And hopefully your pharmacist will kind of reach out to your doctor and they'll kind of talk to each other. That's an ideal situation. Can't say they'll have time for it, but that would be ideal, right? And you can always say, "Hey, can you call my doctor?" Or "Doctor, can you talk to my pharmacist?" Or "What do you think?" And I personally think every like doctor office should have a pharmacist on staff to talk about medications. I think that's really important, especially with like painkillers. Like if there's a pain management, I think they should have a pharmacist on staff. So that way, I know I'm in some chronic pain support groups and I just see a lot of people struggling to get like their pain medicine because they call and a nurse thinks that they are drug seeking, but they don't understand that when you take this medication every day, like it's not that they're addicted, they're just withdrawing. And that's a very uncomfortable thing. And your pharmacist gets it.
Yes, and we definitely need that.
Mhm.
So, real quick, before we go on to talking about what you just mentioned, the dependency, withdrawal, all of that kind of stuff, would you recommend that people like find a pharmacy and build a relationship with them?
Yes. So, there's CVS and Walgreens, the big stores. A lot of places also have small independent pharmacies. I would find one of those, like the mom and pop stores. That pharmacist really, really cares because they are fighting to keep an independent store open when these other big stores are trying to monopolize and take over the whole industry. I have one that I keep trying to get my parents to switch from a big brand to like a smaller one. I'm like, go there, they'll be better. They haven't done it yet, but
Well, I know it can sometimes be like, a challenge, right? To get everything all switched over to a new place. And sometimes that feels like more trouble than it's worth. But, I had
100%.
I had one client years ago who needed a specific brand of a specific medication because they're sometimes a little bit different. And it wasn't until she got to an independent pharmacy that she was able to reliably get that because she was their customer and they're trying to serve her the best way they could instead of her just being one of the hundreds of people that day.
Right,
Yeah.
right.
So let's talk about withdrawal. Actually, let's start with addiction versus dependency. I mentioned this on a recent podcast episode and it sparked a lot of comments on Facebook. You were one of the people that commented on it, which is how
Yes.
we ended up here. So, from a science, biochemistry background, like whatever, what is the technical difference between somebody who is addicted and someone who has a physical dependency on a drug or a medication?
So someone who is addicted has a physical dependency on the drug, but someone who has a physical dependency isn't necessarily addicted. And I think the big difference between them has to do with the psychological aspect. When you are addicted, and when you think about addiction, a lot of people think about the people who are going onto the streets and they're looking for the medication any way they can, and they don't care about the consequences, and they're taking more than is prescribed, and they're crushing up their meds and snorting them. That is addiction, right? This medication has taken over my life. I feel so good when I'm taking this medication that I can't imagine my life without it. Physical dependency, most antidepressants you take, most of the medications for fibromyalgia will create a physical dependency. All that means is if you abruptly take it away, your body is not necessarily going to know how to respond to that no longer being there. And one way to really think about this is type 1 diabetes. Type 1 diabetes, literally, their pancreas is not making enough insulin. If they are, for the rest of their life, physically dependent on external insulin, that doesn't mean they're addicted. They're not ruining their life trying to go find insulin from the local dealer. They literally just need that insulin to function, and their body is not creating enough of it. So, the other thing that can happen too is particularly with pain pills like narcotics. I use that because it's the most common one that's done. If you truly need a medication, it's very unlikely for you to become addicted to it. If you don't really need it and suddenly it makes you feel really, really good, then you become addicted to that high feeling. And then you kind of like back it up and then you're like, oh, I don't really need it, but it makes you feel so good. And the risk when you're in chronic pain is that we are in so much pain all of the time. So many people would just do anything they can to have 10 minutes of relief, even taking more drug than they're prescribed so they can feel better for 10 minutes. And I get that and I feel for them. it's not doing you any benefit. It's not helping you. You're going to have to come off of it eventually. And it's just not fun, right? So, in conclusion, the big difference is the psychological aspects. If you're taking a medication regularly, your body is going to become physically dependent on it. And it's also going to adjust its body, its homeostasis to help that out. So if you are taking like an SNRI, like Cymbalta, your body is then, because of the medication, it now has more serotonin and norepinephrine in its body. So what that means though is basically naturally your body is not using all of that serotonin. So that means like physiologically your body is not giving you what you need. So you take this medication, you take Cymbalta, and now your body is getting what it needs and it feels amazing. And then you become physically dependent on it. There's nothing wrong with you. It's not a character flaw to be physically dependent on a medication. It's just what happens when you take a medication every day.
Right, right. And I love how you put that your body gets used to functioning at whatever medication it might be, right? It could be blood pressure meds or thyroid meds or
Right.
like whatever, right? And so you get used to that. Yeah.
That's why a lot of people who are on blood pressure medications eventually get put on more. It's like a rebound effect almost. Like when you help that, then it's like, okay, well, this other system then is going to get used to it and is going to like overcompensate to try to make up for it. And then you got to calm that system down.
Yeah. So that opens up a whole can of worms of the taking
Yes.
medication for side effects of other medications.
Yes. Polypharmacy is what it's called.
So, a lot of the comments that ended up on that Facebook post had to do with people being a bit afraid to maybe try something their doctor has prescribed because of becoming dependent on it, or potentially down the road if they have to come back off and then dealing with withdrawal and all those nasty symptoms. What kind of advice would you have for them or thoughts that you would have for them?
Yeah, the first thing I would say is that whenever you're stopping a medication, you can always taper off. Just like you're going to taper up to the dose you need, you're going to taper off. And that's how you'll really be able to identify whether or not your body still needs it, because you'll lower the dose a little bit and you'll still be feeling good. And then you're like, all right. And then you give your body some time to adjust and be like, hey, we're going to be living with a little bit less serotonin. Let's see how it is. And what actually might happen is your body might kick in and then be able to make more serotonin to bridge that gap. The other thing that I wanted to say about it is medication is used as a tool. A lot of the medication, unless you have hepatitis C and are taking Harvoni, it is not a curative treatment. Most medication is not curative. What it does is it treats a symptom and helps you manage that symptom. So for me, and what I always think of medication as a tool. So for me, I was in pharmacy school and I was really, really sick. And I didn't know why I was sick. And I had all these antidepressants. And I had two choices. I was like, I'm going to get a PharmD no matter what. And I was like, I could either struggle really, really hard with brain fog, with just the irritability, the confusion, the lack of concentration, the inability to focus, or I could take this medication that would allow me to function in school and then I can get done the goal I had set for myself. So I chose to take medication. It's a tool. It's a tool that's used to help you accomplish what you need to accomplish. So again, going to like pain meds and opiates aren't going to cure your pain and you can't really be on them long term. When you just had surgery and you need to go to physical therapy and you really need to work out that knee, you just got a knee replacement, you really got to work out that knee and you do everything you're supposed to be doing. And at the end of the day, it hurts. That's a tool because you know that you need to go there and you know it's going to be sore after, but there's no point in suffering because you need to do it. Is there some suffering? Yeah, okay, it hurts. Okay, but it hurt before too. So I always think of medicine as a tool to help you accomplish what you want to accomplish and allow you the mental faculties, give you some clarity for you to figure it out what it is you need. It may be like, I just needed this extra serotonin and then you're on it forever. It may be like, I needed extra serotonin for a little bit and then I just know deep in my soul there's something else. That's how it was for me. I knew after I was like taking all this stuff, I was like, this is great and I'm functioning. There's more to the story here.
Hmm. Yeah, my story is very much like yours in that way. I mean, the medication that I was on was crucial at that point. And the biggest thing it did for me was give me the mental and physical capacity to figure out the other things.
Yep.
Right. And then be able to address all the underlying stuff and eventually then not need the medication.
Yep. Like a big one for me was like modafinil, because I also had sleep apnea, and it was just, I needed energy, and there was no way I could function without energy. There's nothing wrong with that. I'm not taking more than's prescribed. I'm taking exactly as prescribed so I can get through what I need to get through. And then I was able to go to my doctor appointments. I was able to go to physical therapy. I was able to go to Pilates, by the way. Love Pilates. Highly recommend for chronic pain, especially reformers. By far the best thing ever. But without that medicine, I was never going to be able to show up there. And then if I don't show up to Pilates, I'm not getting stronger, and then I'm not moving forward. And you really need that medication. That medication is there to help you. So take it.
Yep. Yep. 100%. I agree. So you and I had talked a little bit about some tips for helping people taper off for whatever reason, whether it's not working for you or you're feeling good and you want to try coming off. Maybe you've heard horror stories of
Mm-hmm.
people coming off of things like Cymbalta.
Mm-hmm.
So let's talk about some of those specifics that people can do.
Go slowly, go slowly, go slowly. Like,
and slowly means more slow than you're thinking, y'all.
right. Like, not like every day, like a week to 2 weeks to a month. And so it took me a few months to get off Cymbalta. And I know some pills like Lyrica and Cymbalta, they're like capsules. You can literally open them up and split all of those little beads over the course of a week. So even once you get like the smallest dose, you can make it smaller. And even sometimes you can ask, you can actually, this is a fun fact, you can ask compounding pharmacies to literally compound the medication and put it in a liquid so that way you can have an even smaller dose. Find out what you need. Find a compounding pharmacy to do it. Open up your capsule and use the little beads. Because what might happen is, you're at 25 milligrams and you don't need 25 milligrams, but when you go to 0, you just have horrible withdrawal symptoms. For me specifically, I would shake really bad. I would have really, really bad shakes. I would be uncontrollable. I'm like, I don't know what's happening. And then I would take my little dose of, I was taking like 3 beads of Cymbalta. Okay. And there's like 20 in a tablet. So I'm like taking such a small dose, but I would take those 3 and the shaking would stop. And so eventually what happens is like you lower the dose and then you're like, okay, I'm having a withdrawal symptom and it's cleared when I take Cymbalta. So that tells me that it's a withdrawal symptom. And eventually you just have to decide, I just want to move through this withdrawal symptom and I'm just not going to take it. And maybe you don't take it for 3 days and then you're like, I can't take it anymore. And then you take a Cymbalta. That's okay. You're not a failure because you have to go back on it. I actually got completely off of it and needed to go back on it. Right. So the biggest thing I can say to you is you have to trust your body and you have to listen to yourself and you have to be willing to go at the body pace. The mind wants to be off of it immediately. Medicine is bad. It is outrageous, whatever. No, it's not. It did exactly what it needed to do. And now we're just going to go slow and help the body adjust. I especially think people with chronic illness, their bodies are a little slower to adjust sometimes. Like they're just very sensitive, right?
Yeah.
So just by going so slow and by like decreasing a month at a time, you like figure out what it's going to feel like. And then it's not so scary. And then you're like, wow, I still feel good. Or maybe you're just like, I feel okay. So I'm going to stay on it slowly.
Right. I so agree about the fact that it's just a tool. And so once we know what it is that we want, what we're trying to accomplish, right, then we can figure out what tools that takes, like you finishing pharmacy school, right? Like in order to do this, I'm going to need this kind of help, kind of a deal.
Yeah. And it's cool too, because I think medicine can show you what your ideal is. So when I'm taking medicine, when I'm feeling my best, this is what my life looks like. So I'm going to decrease my med. And how can I make sure my energy stays that level? Do I need to make sure I'm working out? Do I need to make sure I'm drinking enough water? Do I need to adjust when I'm eating? What do I need to do to lower my medication and still feel that same energy?
I love that. That is so true. Sometimes it does give us that glimpse. One of the comments I got on Instagram was, how did I know when it was time to start coming off my Cymbalta. And for me, it's kind of exactly what you're describing. Like I had gotten to this place with my fibro on medication where my pain was well managed. I was able to do the things I wanted to do. I was coaching, I was going to events, like, all the things, right? So I'm like, okay, can I do this without Cymbalta?
Yep. That's literally how it is. And I always recommend having a doctor because sometimes when you get off of it, it can be scary, especially like if you're getting off Cymbalta, possibly finding a psychiatrist even who's very just familiar with it because it is also an antidepressant, which I know you got a lot of angry comments about that too. But pain is also psychological. It's just the nature of it, right? Your body senses feeling and your brain transmits it into pain. So sometimes, really, all that's happening is that your body has received enough pain signals to say you're in pain. So whenever someone touches that part of your body, your brain tells you you're in pain. And maybe you're not, right? So you'll know when it's time to be ready when you think about your pain and you're not panicking about it.
Yeah, that's a good way to think about it. Yeah. You mentioned when we were talking before I started recording about having medical PTSD, which is something that I definitely have medical trauma in my past. And a lot of us do, sometimes just from the not necessarily even traumatic procedure or something,
Right.
but just the trauma of people not believing you. Right.
Oh, yeah.
So I love the idea of bringing some mental health help in there as well.
Yeah. And I actually love that you do coaching because I think a lot of the healing happens between doctor's visits. You don't
It
go to the
does.
doctor expecting to heal. You go for advice and they give you tips, and then you have to implement it between the visits. And then you go tell them how it's working. And I love the idea of coaches. Like, my vision is that every practice has a coach or some sort of like, hey, I just need to talk for someone for 20 minutes to just calm me down a little bit. Oh my gosh, I just tapered. I'm feeling silly. Like, I'm feeling uncomfortable. Does this mean it's never going to work? Does this mean I have to be on medication forever? Nope. Let's take a deep breath. This is like your body adjusting. We know what's happening because the other thing with withdrawal is you have to realize that you are going to experience some sort of uncomfortable symptoms. That's just the nature of tapering. It's the nature of withdrawal. And if you can get through 3 to 5 days, it is likely that then you'll figure out how you really feel. And so I have a lot to say. Sorry.
No, you're good. You're good. We probably have like 15 podcast episodes of
Oh,
things
yeah,
we can talk about here.
definitely.
So, a lot of people have this negative connotation with withdrawal, right?
Yes.
And I've even noticed myself in our conversation, when you say the word withdrawal, it's like there's a little piece of me inside that cringes.
Yeah. Yeah. It's always been associated with addiction. And that, I think, is why we're all like, oh, but I'm not addicted. I'm not addicted. Therefore, I'm not going to withdraw. I'm sorry, friend. You're on a medication. You're taking it daily. You're going to have some withdrawal symptoms. You've been giving your body this medication and now you're taking it away. Your body's going to protest a little bit, but hey, I really want that medication. It makes me feel so good. Why are we stopping it? And then you just have to talk kindly to yourself. Hey, I know you want it. We're going to try to go without it and see what happens.
So, how would somebody know the difference between I don't feel good because I'm going through withdrawal and it'll be better, and I don't feel good because I actually do need that medication and I should not try to discontinue?
That's a great question. It really comes down to trusting yourself. And I hope that while you're on medication, you're doing the work to get to know yourself so that way you can identify what it feels like when you're in a flare. Even when you're on medication, you still flare. Know what that is. Lean into that pain. Trust that pain. It's telling you something. What did you do too much of, right? I went to 3 events and I usually only do two. And I went to that third event and the next day I was really tired. That's a pain thing, right? If you don't take the medication, so for me, what it usually felt like was like I'm shaking, I'm kind of confused, and I'm like, why am I feeling so weird? And then I'm like, oh, because I didn't take my medicine. So
Right,
you
right.
trust your instincts. You know, right? People want someone else to tell them what they're feeling. You know what you're feeling, and all a doctor can ever do is guide you to kind of to figure it out. But ultimately, they're just asking you questions to help you figure it out.
Right, right. Would you ever work with just a pharmacist on discontinuing a medication, or would you always be working with your doctor on that?
I think you could definitely work with a pharmacist. I think it should be both. Like your doctor should say, hey, you can taper off of this. And then they're just like, okay, taper off. And then you could go talk to your pharmacist and say, hey, what do you think about this taper schedule? Should I go slower? And they might be able to help you find a plan that better fits you.
Awesome. Oh my goodness, we have so many things we could talk about.
Yes.
So, is there anything that people don't know or don't often utilize with their pharmacist that you wish more people knew?
I just wish they knew they were there, right? So pharmacists used to be one of the most trusted professions. And I would love for that to be coming back. I would love for people to reach out and ask their pharmacist about the medication. I would love for them to trust that they know what's going on. They know your meds, and not only that, they see your whole profile. So when you're going to the same pharmacy, I am sure that your pharmacist recognizes your name. Say hello to them. I mean, they might not have time to have a whole big conversation unless it's specifically about meds, but they want to. They want to help you. Like people become pharmacists because they want to help patients. They do not become a pharmacist because they want to stand behind a counter and verify prescriptions all day. It's just part of the job. They want to help you.
Yeah, I know when I was first diagnosed, we tried a whole bunch of different things. So I felt like I was at the pharmacy about every 2 or 3 weeks. And I know that guy got to know me.
Oh, yeah. Yeah, they do. And they want to hear and they want to help you. And so the other thing is your pharmacist can tell what's going on based on your meds.
Right. It's not like your health is a secret when they're like, oh, this is a blood pressure medication. This is fibromyalgia medication. This is a
Right, right, right. And yeah, just talk to them.
yeah.
They want to
Yeah.
help you.
How about trying medications and then having side effects? I often think that our bodies are so unique that one thing might work where another one doesn't, or in a different way. How would somebody go about figuring that out? I mean, most of us, we would just go to our doctor, but we don't really know what to ask or like other than I don't feel right.
Hmm. Yeah. So again, like I said, always trust yourself and get to know yourself and get to know your symptoms before you start it. That's what I would recommend. You know, your doctor's always going to say, what helps? What makes it feel better? What makes it feel worse? Those are questions you should really always be asking yourself. The other thing that I'd recommend is checking out the package insert before you start it and read the side effects. It will say these are the most common side effects like dry mouth, nausea or vomiting, constipation. Some meds I know increase sweating, some meds can just cause more irritability. So just being aware of them before you start taking them. So that way, if you're like, wow, I'm a little bit irritable. And then you're able to actually like be like, oh, I just read that that's a side effect for Cymbalta or whatever, as opposed to just being like, is this my fibromyalgia or is this my medication? And a lot of side effects will go away in a few days. So if it's pretty constant and it's not going away after a few days, I would go to your doctor and say, hey, I read that this was a side effect in the package insert. Is there something else we can try? This is unbearable. Your pharmacist will also be able to recommend things that can help you manage it. So if you have constipation, they might recommend a stool softener, right? And that can help you kind of manage some of the symptoms. They do usually get better, but if they don't, then you would go and ask for something different.
So how long is the usually get better? Like how long should we give something before?
I'd say about a week. If it's not getting better at a week and you haven't found anything to manage it, it could be something that the drug is then going to cause you.
Awesome.
So I wanted to touch real quick on medical PTSD. I think I got sidetracked for a minute.
Yeah, please.
So I think it's just so hard because you go to a doctor and they don't always know. And I think that the standard healthcare system today focuses a lot on which medication can I prescribe you to help your symptoms. Doctors don't know side effects, right? The pharmacists do. So for me specifically, my issue was I developed heavy metal poisoning, copper toxicity, that was contributed by birth control pill. So I remember in college, I would go to the doctor and I would say, is it possible that my birth control, the one thing that has been constant through all of this, is contributing it to it? No, 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 you're fine. You're fine. It's fine. None of them checked copper. None of them checked any of these things. And it turned out that copper was the main issue. Like my level was like off the page high. It's really hard when you are like, I know something is wrong with me. Like I would go to a doctor and be like, I know something is wrong with me. And they would kind of be like, uh-huh, sure. And then they do the basic blood tests, right? And so this is the other thing that gets me knowing what I know from pharmacy school. Most doctors will test your CBC and your basic metabolic panel, which is great. It will be very obvious if you're in a crisis. If you have sepsis, if you are in organ failure, it'll become very obvious. When you have a chronic illness, that doesn't show up on those lab levels. Chronic illness shows up in a CRP and an ESR, right? The C-reactive protein, the sedimentation rate, like heavy metals, like how's your copper level? How's your zinc level? Do you have a zinc deficiency? And I know that there's actually a lot of research now that shows that copper zinc imbalances can cause mental health issues. And so if you have fibromyalgia and you're sitting there, you're like, I know something is wrong with me. Like, I get that I have all of these symptoms. I get that it fits fibromyalgia, but it doesn't feel right. I encourage you to go find someone who will look deeper, who will look at all of those things, who will do urine collection tests, who will do saliva tests. I had to go outside the healthcare system and find a holistic doctor to be able to figure it out. They don't take insurance. So it's definitely a privilege to be able to go to one. But if you can swing it, I highly recommend it. Highly, highly recommend it. Because that is where I found answers. I just had a lot of doctors who told me I was fine, that I was too young to be in pain, that I needed to lose weight. And that caused me a lot of trauma. I literally have a service dog now because I said service dog and she looked at me. Uh,
Lucy, by the way.
yeah, Lucy. And she comes with me on all my doctor's appointments. And it's just something that happens. And I know there's people listening who are like, oh, I know, right? Like for me, blood draws too, traumatic. I'm just a very difficult blood draw. And then when I go and get my blood draw, they're like, you need to stop panicking. You're worrying too much. And it's preventing me from having a successful blood draw. And I was like, I don't know about you, but I'm pretty sure my thoughts are okay right now because this happens every single time. And I've convinced myself that I'm okay and I'm safe and that they're going to do it. And you telling me that I need to stop worrying, that my adrenaline is causing the issue, you're not helping me. You're not
No.
making me feel seen. And like, just say I'm a difficult draw and that you couldn't do it today.
Right.
And I wish more doctors were able to say, I don't know.
Yes. Oh my gosh. Yes. I don't know if you know this, but I am privileged to be able to talk to medical students about 3 times a year. Oregon Health and Science University, I get to be part of a pain patient panel each term up there. And like that is one of the big things that I try to get across to medical students. It is totally okay if you say you don't know. Like as a patient, I would rather have you say you don't know than to blindly be trying things you don't know. Like that releases me to then find somebody who does know, or we can like investigate together, It's just such a big, big thing.
Yeah. Like I actually am working on a blog post right now about 3 things doctors say and what they really mean. They say, like, I can't help you anymore. All that means is they've maxed out what they can do. If they say nothing's wrong with you, all that means is that physiologically on a basis level, nothing is wrong, but they always try to like diminish your pain. Nothing's wrong with you, therefore you can't be in pain. Okay, but like I'm still experiencing pain and I don't know what you want me to do about this. And then the other thing is they say it's all in your head. And I don't know if you know about brain pain. Have you heard of that term?
I don't think I've heard that term, so I'm curious where you're going with that.
So say you broke your arm. It should heal in 6 weeks, right? After 6 weeks, it should heal and your brain is like, okay, whatever, we're good. Brain pain is when it turns chronic and you now have pain in your wrist or your arm for like 6 months or more. Your brain has rewired to be extra sensitive to that condition. So now when they say nothing is wrong with you, meaning your arm is healed, and it's all in your head, meaning your brain has literally rewired. So you might need some medication to improve the conditions for you to easily be able to rewire your brain back to the point where my arm was broken, it's not broken anymore, and it's safe and it's okay. And it's telling me it hurts, but I know that everything's fine.
Right, right. One of the things that I've said often, like everything is in your brain. Like without a brain,
Yep.
we wouldn't be experiencing much of anything.
Yep. Yep. And pain originates in the brain.
Yeah, it is. That's where we process everything. So really, it's all in your head.
Right. Definitely. I would be concerned if it's not in your head.
Right, right. You know, one of the other things, speaking of all of this and what doctors say and what we wish that they would say more plainly, is this conversation about discontinuing medications. We see it a lot as pain patients with our pain medication, right? Doctors wanting to decrease the opioids we're taking, right? And I think it's really important for all of us, doctors, patients, both, to understand that that conversation that we're having really is not about the pain meds. That conversation is about our ability to go out and live the life that we want to live. And taking away that medication isn't about, oh no, what am I going to do without that meds? It's about, oh no, am I going to be able to live my life?
Right. It reminds me of like training wheels. When you're a little kid and you want to take off the training wheels, it's not that you're afraid of the bike. It's not that you don't want to ride your bike. You want to ride your bike, but you've always known the only way you've been able to ride a bike is with training wheels. The only way you've recently been able to live your life is with pain medicine. And now they're like, all right, let's get rid of it. Let's get rid of the training wheels. And you're like, am I going to be able to do this? Am I going to be able to function? And that's why I think a coach should be in providers' offices to be able to coach them through that process so it's not so scary for people.
Right, right. Exactly. Oh, well, it has been such a pleasure having you on. Oh my goodness, we're going to have to talk again for sure. Tell people a little bit about the other things that you do because they will have heard in the bio about your books and the
Okay.
coaching that you do. So share a little bit about that.
So I wrote two books. I wrote TMJ is Ruining My Life, How to Manage Jaw Pain So You Can Eat Normally. One of the first things that I dealt with was TMJ. And there's actually a lot of TMJ doctors now, TMJ dentists. And when I was younger, though, when I was dealing with it, there really wasn't much. And I just remember being like, I'm going to write a book that I wish I had when I was a kid. And so I really think that a lot of TMJ, you have to understand it. And, a lot of doctors are like, you have TMJ dysfunction. And you're like, okay, cool. What do I do? And here's this really expensive mouth guard. But you're like, was that even going to help? I don't know. So I'm coaching people on TMJ pain now, trying to learn to live with pain. It is possible when you're in pain that your pain doesn't necessarily ever improve past a 3 or 4 on the pain scale, but you can still live your life. You can still have a very fulfilling life and learn what your limits are and learn how to basically track it a little bit so then you can predict. Like, hey, I really want this steak, but this steak is going to make my jaw really sore. So I have to be prepared that I'm only going to eat soup the next day.
Mm-hmm.
And just kind of figuring that out. I also wrote another book about service dogs, Life with a Service Dog, Make an Informed Decision to Get a Psychiatric Service Dog. A lot of people, when they think service dog, think guide dogs, dogs leading the blind and like
Opening the refrigerator and turning off the lights. Yeah.
yeah, they also can do things for mental health. They can do deep pressure therapy where they just lay on you. So my dog will just literally sit in my lap and put her head on my shoulder, and it's the most precious thing. They can alert to, like for me, I have complex PTSD and I dissociate. There's usually a symbol signal that I give off before I do that. And she'll come like interrupt it and like nudge my hands. And then I'm like, oh, look, there's my dog. Like I'm in the present moment, helps bring me back to the present. Like some people are pickers, they pick at their fingers, they can interrupt that. So your service dog can do a lot more than just lead the blind. And they're different, and it's something that has really, really helped me. By having a service dog, I was able to go to a holistic doctor because by the time I got her, I was so sick of people telling me I wasn't in pain that I was afraid to go see a new doctor. And so I was able
Yeah.
to bring her, and definitely think some things to consider with service dogs, like what's it going to be like in public? And there's some public access issues, and it's different than an emotional support dog, and kind of the difference. That's what that book is about. And then I also just have a Facebook community, Cozy Cove Life, kind of my little brand kind of going on. I just am thinking that everyone needs to be cozy. That's why I'm in a little swing right now, living my best life inside, hammock inside. So we have a Facebook community where I just kind of talk about some pain things, and it's just really about support and community and being with other people who are struggling with pain.
I love it. I love it. And everybody, we are going to have links to Chelsea's books and her Facebook community will all be out there. You just go to, let's see, this is episode 92. So go to fibromyalgiapodcast.com/92 and we will have all of those links out there for you. If you guys are interested in hearing more about the service dog aspect of things, of course, you can read Chelsea's book, but also we did an episode back in episode 55 where we talked about some of the differences between emotional support animals and service animals. So you can check that out too. We'll have a link to that. All right. Well, to wrap up, is there anything, thoughts or encouragement you want to give to the person listening to just help them along?
Yeah, I just want to say that I believe you, that when you think something is wrong, it is probably wrong, and keep going until you find the answer you want. Just because a doctor doesn't know how to help you doesn't mean that there's not an answer. It just means that doctor doesn't know how to help you. And find what you need and advocate for yourself and always ask for what you need.
Awesome. And don't be afraid to use all the tools that you have available at your disposal, including medication.
Including medication.
All right. And that wraps up my interview with Dr. Chelsea Liebowitz. Now, as I mentioned at the beginning, after I turned off the recording, she shared some really valuable information on what to do if your insurance denies coverage for a particular medication or doesn't cover enough of it. There are things out there called patient assistance programs that are supported by the manufacturers of these medications. So just to use an example, I get Botox for migraines. If your insurance denies coverage for you for Botox or maybe doesn't cover it at all, you can apply for a patient assistance program for Botox. And the way that you would find this is just to go online, do a search, type in Botox, and then PAP for Patient Assistance Program. And that will give you information on how to apply for a patient assistance program for that particular medication. Just substitute in whatever medication you're looking for, Lyrica, PAP, Cymbalta, PAP, and you can find what assistance programs are available. Dr. Chelsea made it super clear that whether you have insurance for these medications or not, if it's something your doctor has prescribed and you aren't able to pay for that out of pocket, do the search. Apply for the patient assistance program. She said these programs are often at 300 to 500% of the poverty guidelines, which means that for a single person, that would be making under $80,000 for the year. So it's a pretty high limit. And so you may be able to qualify even if you haven't qualified for some other things because of income. So definitely try it. She also said if your insurance denies it, do it anyway. If your insurance doesn't cover it, do it anyway, even if it says that you need to be uninsured, because sometimes they consider those situations as being underinsured because you're not insured for that particular thing or your insurance isn't covering it. She said, do it anyway. Worst case scenario, they say no, but if you don't apply, they can't say yes. So try it anyway. I also want to add on to that there are also sometimes savings programs or copay cards where the manufacturer will pay a certain amount. I have a savings program for my Botox where they cover anything that insurance does not cover. It actually makes it free for me to use Botox, to have the Botox. Now, if you go to the Botox Savings Program website and you see that it says you have to have insurance in order to apply for that, that's okay. That's not the program you want if you don't have insurance. You want to go look at the PAP, the patient assistance programs. The other thing is those copay cards that I just mentioned. This is where you have a card with a particular code on it, where the manufacturer covers a certain amount of the copay. And so it makes your copay less for that particular medication. One of the inhalers that I was on for a while had a savings card for the copay. So there's a lot of other options out there. Search for those patient assistance programs. Look at the manufacturer's website for that particular medication. Often the medication will even have its own website, so you can go look that up and see what assistance you might be able to get. Now, I have this week's listener shout out for you. This comes from Jo in the UK, who gave me permission to use her name. She said, I came across your podcast 3 days ago because I had gotten into a slump and wondered if there was any self-help fibromyalgia podcasts out there. And I have been binge listening to them ever since. So many of the things you say ring so very true, and I have already shared your podcast with 2 other of my fibro friends. I really want to say a big thank you. Big thank you, she says. And I'm so determined to be where you are now at pain and medication free. Kindest regards, Jo. Thank you so much, Jo. And thank you for sharing the podcast. I hope that your friends find this as valuable as you do. And I just love hearing from you. Now, don't forget, go out and share your love note as a review of the podcast, if you would. All right, everyone. Thanks so much for being here this week. And I will see you back here next time as I interview one of our certified fibromyalgia coaches, Julie Hamilton, about her new book that is launching at the end of this month. See you then. And that wraps up another episode of the Fibromyalgia Podcast. I'm your coach, Tami Stackelhouse. For daily doses of hope, inspiration, and practical advice, come hang out with me on Facebook. Visit facebook.com/fibrocoach to find my personal coaching page and connect with me directly. To find the show notes, additional resources, or to schedule a consultation with me or one of my coaches, visit fibromyalgiapodcast.com.